Most congenital cataracts can be adequately aspirated with a simple two-way syringe. Use of the emulsification apparatus developed for senile cataracts, however, not only provides a sophisticated aspiration system, but allows the surgeon to activate the tip vibration at high frequency if a hard piece of lens is suspected or encountered. A thorough removal of the lens is possible with this technique. It is most advantageous in hard congenital cataracts, all young adult cataracts which might be difficult to remove intracapsularly because of the danger of vitreous loss, and traumatic cataracts. The apparatus consists of a control panel which is activated by a technician, the emulsifier handpiece which activates the longitudinal motion of the needle, the titanium hollow needle which emulsifies and aspirates the lens which touches it, and the silicone sleeve through which replacement irrigating fluid enters the eye. The irrigating fluid enters the eye by gravity feed at 25 millimeters of mercury. The suction pump creates a vacuum which increases automatically if the piece of lens is hard. The control panel monitors all functions, including the logic system of the suction. The flow meter monitors the rate of suction and guarantees that it does not exceed the input. The timer measures the seconds of ultrasonic action, which in most young patients is well under 1 minute.
Doc, that was a marvelous intro.
Keep it clean, Bill.
I must tell you in all candor, in all honesty, that my association with Charlie Kelman is obviously not as lengthy as yours has been. But this past Tuesday, a couple of days ago, I allowed this swinging musician to delve into my eye. And you may have read about it. Last Tuesday, Charlie did Jan Pierce and myself. And I don't know if you can realize what a thrill it is in the middle of an operation on your eye to have the doctor lean over and hum Stardust. And I'm looking up saying, "Schmuck, just do your job." As if that weren't enough, on the next table, some guy is doing Col Nidra. Now, I don't know whether I'm dying. It really is a fascinating thing. But as I say, in all honesty, I know he's a brilliant surgeon. But again, in truthfulness, I have never heard Charlie with his axe. I've seen him with his vibrator or whatever the hell that thing is. It's a vibrator, right? Yes, now I'll tell you a story you may not know. It's a vibrator. It vibrates at 40,000 cycles per second. And I said, when I first met Dr. Kelman, I said, "What's the story?" So he said, "Well," he said, "it's a vibrator." He said, "As a matter of fact," he said, "the way I originally discovered this, a very pretty young woman came into my office and she had a vibrator stuck. And she asked that I get it out. And I tried and tried to no avail, and I said, "I don't know how the hell you got it there, but I can't get it out." She said, "Well, can you give me a couple of batteries?" 2, 3, 4. She was a strange lady. I am an unabashed fan of musicians. And so I will sit here tonight and listen to the doc do his thing, do his acts. Now, also, I understand that the good doctor will enlighten us tonight as to how tender his tonsils are. I am looking forward to this because, as I remember, I was under a general anesthetic, but there was a great similarity to Tiny Tim. And if that's true, you're going to see a guy get up and get the hell out of here so quickly. No, I'm looking forward to it, so I wish you would join me in welcoming not the professional man in the medical sense, but the professional man in the musician sense. Join me in welcoming to the stand Dr. Charles Kelman.
Thank you very much. I want to welcome you to New York. And I want to tell you something you probably know about me. My whistle. I can't live without a challenge. And since the operation has been fairly well accepted, kind of the thrill is gone. And so I had to look around for another challenge, one that would occupy my mind. Could we cut down the whistle a bit? The first challenge I thought of was trying to make an elephant fly, but that was too easy. I wanted a challenge that would really be something. And I came up with a challenge that's absolutely ridiculous. I've done a lot of things all through the years. Crazy and wild things in many careers. But in my book,
should be somewhere healing, not in front of you squealing. But for me, it's appealing. Yeah, 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 yeah. Well, if you think I'm crazy and out of my cage, you're even worse off than me, I would gauge. You're out there listening, just think about that. Listening to me singing Fly up here on the stage. Yeah. But what does it take to get up on the stage and sing? A great voice? No. A manager? No. A lot of talent? No. You know what it takes? I think I heard the word. I think I heard the word. Nerve, moxie, or a word that some Irishman is taught me tonight. Chutzpah. A little chutzpah used judiciously will open any door without a key. A little chutzpah does wonders for you. Try it, you'll like it. Your dreams will come true. A little chutzpah will carry you far. That is the secret of every great star. If you're a poor man who works in a ditch, use it and you may become very rich. If you've always been afraid to do your thing, then you really require it. Don't just sit and desire it. Stand up tall, you'll acquire it. Yeah, 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 yeah. Well, if you think that we're nuts here tonight, we may bring others back their sight. So just sit back and we'll have some fun. For I have by the time performing for you. And if you want to hear some real chutzpah, listen to this. Performing for you.
Last night when I mentioned that Dr. Kelman, it was going to be Charles Kelman, was going to be on our show, and I said he's a singing ophthalmologist, everybody thought it sounded like a joke, but it is not. He is one of the foremost ophthalmologists in the world. He's been written up in virtually every major publication as the result of his fabulous work, incredible work in cataract surgery. But more than that, he's a saxophone player, and he's a singer, and he's going to appear in concert at Carnegie Hall on March 1st. We thought you might like to meet him. Would you welcome Dr. Charles Kelman? It's nice to meet you. Last night, at the end of the show, I said, tomorrow we have Dr. Charles Kelman, the singing ophthalmologist, and I sound like Ted Mack all of a sudden, you know? And here's the singing dental hygienist from Bayonne.
But you called me an ophthalmologist, which
Yes.
is great. Ed called me an ornithologist.
What the hell?
That means a bird watcher. Have you been following me?
Well, I think he thought maybe you did cataract work on birds. See, and he probably got confused. Ed's been known to do that.
We treat all sexes.
Ophthalmologist. Now, people get confused sometimes. Optometrist is somebody who recommends
He measures your eyes for glasses,
Right.
basically.
an ophthalmologist does care of the eyes,
An
surgery.
ophthalmologist is someone that's had 4 years of medical school, internship, and a residency program.
Right. Now, you've done some fabulous... I've known people who have had problems and had the cataracts removed, and I've heard about the laser surgery that they do and so forth. But you've developed something else that's rather unique. Not that it's a bad thing. It is unique.
Without dwelling on ophthalmology, basically there are two ways of taking out cataracts. One is by freezing. And that's a method that I introduced to this country about 12 years ago. It was originally unbeknownst to me, developed in Poland.
Right.
And I developed the first instrument here, and that's now the standard method of cataract surgery. And this is what most ophthalmologists perform.
Right.
And I just want to say that it's 98% effective, and it's a perfectly safe operation, and anyone who has cataracts
It's a
should
cataract
not
are
go
common.
around looking for a new operation. They should
Yeah.
stick with their local ophthalmologist, and not just because there's something new
Yeah.
go looking for it. The other operation, which I've recently developed, is an ultrasonic needle, which goes into a tiny
Right
hole.
away it sounds, every time the person hears the word needle.
Well, this is a needle that's vibrating in the key of E flat. It's true. I play
Okay.
E flat sax and E flat cataract.
That's true, though?
It's vibrating 40,000 cycles a second, and that is E flat.
And that, you go in
And
and...
you go in through a tiny hole and you dissolve the cataract under a microscope. And this isn't important to every patient, but to some patients it's important to get out of the hospital immediately and go back to work. And so for those people, it's...
Cataracts are a very common ailment, are they not?
Yeah, you can get them in children, congenital cataracts, or I think anybody, if they live long enough, will develop cataracts.
Really?
Yes.
But now it's not, you can't
I
go
saw
in.
Ed rubbing his eye a minute ago. Ed,
Why not?
But, what do you mean? Do people rub their eyes? I have a habit of doing that. I suffered from conjunctivitis and still do occasionally. Is there any cure for that?
is this a professional question?
Oh. Let's see, taking into account the fee for here, is there any cure, or is that just something that is,
Conjunctivitis?
yeah, I don't get it much
You have
more
to wash your
medication.
hands very often.
Is that true?
Yes, you catch it from things on your hands.
But I've also read from psychiatrists that people who have a fetish about washing their hands all the time also have guilt about sex. Have you ever read that? The people who are overly clean all the time and keep washing their hands have some kind of hang-up about that.
I
don't want to be considered, washing 4 or 5 times a day.
I never wash my hands.
You never... Great advertisement. Have you ever... well, this may be a touchy question, but have you ever lost a patient through this? I mean, is this surgery that delicate that...
You mean lost a patient where the patient expired?
Yeah, I guess people always say expired.
Well, not exactly.
I mean, terminal city. I mean, that's...
Not exactly.
Yeah. Not exactly.
Well, I was in Bologna demonstrating this operation to several hundred ophthalmologists on closed-circuit television, and everything went beautifully. But at the end of the operation, the professor came to me and he said, Dr. Kelman, I have a very serious problem. There's an important man from Sicily here. Very important in certain circles. He said, this man never married, but he and his wife have a pet monkey. Now, this monkey does a trick. He said, this monkey, when they have a dinner party, he goes to the telephone, goes through the phone book, dials a number, goes bloop, 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 and passes the phone to the guest, and it's always this man's mother. Now, lately, the monkey had been dialing the wrong number because he had cataracts. It's a true story.
Well, you couldn't make this up. I mean, this...
And the professor said, would you mind doing this monkey? I said, well, look, I don't mind doing the operation, but monkeys are very delicate. And anesthesia is tremendously important. He said, well, we have the best anesthesiologist in the whole world, Dr. Lasagna. I said, fine, okay.
Dr. Lasagna.
Well, I don't remember his name
That's
exactly.
close.
So we operate that night, and it's like a who's who in ophthalmology. All of the European professors are there.
So you agreed to take this on?
I took it on, sure. And I go in, and I'm fooling with my machine, and I meet Dr. Lasagna. And the monkey's very cute. The monkey's pinching the nurses, and they're putting him down and jabbering away. Very, very bright monkey. And out of the corner of my eye, I see Dr. Lasagna with a syringe this big go, whoosh, and the monkey goes, bloop, 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 bloop. And I say to the professor, that monkey's had it. And he says, no, start the operation.
So I start the operation, but I really wasn't sure because I'm not an expert on monkeys, you know. Operating on the eye. And it's just not reacting. After about 15 minutes, the anest, Dr. Lasagna, says, "Muerto, muerto." And I say, "Muerto? He's been muerto for 20 minutes.
Yeah. As soon as he got the anesthetic, you know.
I knew what was outside, so I made tracks for my car in the parking lot, and I thought I was going fast. But Dr. Lasagna made me look like I was standing still.
Dr. Lasagna and the
He
monkey
was out ahead of the monkey.
went to that great vine up in the sky, huh?
Unfortunately.
You never met anybody lady say, "What happened to the monkey?"
But after tonight, I might.
Hey, don't dial the phone anymore. Can't call Mother.
We're going to come back and you're going to do something for us, right?
Sure.
Here's Dr. Charles Kelman.
This is a song I wrote about a little blind girl. How I'd love to see a butterfly fly away. And I'd love to see the flowers blooming and to watch the sun turn red each day. How I'd love to see my daddy smile when I sit on his knee. And someday, if I have my own children, how I pray they'll see me. I can hear a world of laughter, lovely sounds. They seem enchanted, yet I miss the only thing. It's the very thing you take for granted. Open up your eyes and you'll see me. That's all you have to do. And someday, if I am really lucky, I'll see butterflies and you. Open up your eyes and you'll see me. That's all you have to do. And someday, if I am really lucky, I'll see butterflies and you.
I almost want to say that was our singing ophthalmologist. We're going to take a short break, Peter? We're coming right back. Stay with us.
1, 2, 1, 2, 3, 4. You're walking along the street or at a party, or else you're alone and then you suddenly tick. You're looking in someone's eyes, you suddenly realize that this could be the start of something big. You're lunching at 21 and watching your diet, declining a Charlotte Russe, accepting a fig. When out of the clear blue sky, it's suddenly gal and guy, and this could be the start of something big. There's no controlling the unrolling of your fate, my friend. Who knows what's written in the magic book? But if a lover you discover at the gate, my friend, invite her in without a second look. You're up in an aeroplane, or lunching at Sardi's, or down at Malibu, alone in the sand. When suddenly there's a bell, and right away you can tell that this could be the start of something. This could be the start of something. This could be the start of something really, really, really. And I hope it is.
So what does Dr. Kelman do in his spare time? Well, you wouldn't believe it. He is a recognized jazz musician. You would believe it if you just heard him play. He is a superb saxophonist and clarinetist. But more than anything else, he adores singing.
I can hear a world around me. Such lovely sounds. They seem enchanted. Yet I miss only one thing. It's the very thing you take for granted. How I'd love to see a butterfly fly away. And I'd love to see the flowers blooming and to watch the sun turn red each day. How I'd love to see my daddy smile when I climb on his knee. And someday, if I have my own children, how I pray that they'll see me. I can hear a world of laughter, lovely sounds, they seem enchanted. Yet I miss the only thing. It's the very thing you take for granted. Open up your eyes and you'll see me. That's all you have to do. And someday, if I am really lucky, I'll see butterflies and you.
Dr. Charles Kelman.
David. My daddy and me, we're having a ball, just watching the girls, the short and the tall. And when we find a pretty face that's right for us, well, we invite her in our little mini bus. My daddy and me will end up in jail, but Mom won't care or send us to bail, because she said so many times, like father, like son. But my daddy and me, we're having fun. My daddy and me, we're out on the road, just bumping some rides, eating pie of more. And when the darkness comes and we must go to sleep, well, we just find a phone and hide the window sheet. My daddy and me, we're covered with grime, and so we agree that it's about time that we went home to Mama, and so we'll find a path. 'Cause my daddy and me, we need a back. Yes, my daddy and me, we need a back. Oh yeah. Hey, yeah. If your heart aches or your back breaks, I will cure you and set you right. I'm a surgeon with a scalpel. You can call me Chuck the Knife. From your head down to your big toe, I will fix it. You bet your life. If you hate it, I'll amputate it. I'm your good friend, Chuck the Knife. Miss Sebastian had indigestion. I alerted the main OR. Now her heart yearns for her heartburn, 'cause her stomach is in a jar. Young Miss Winter, she had a splinter, came to see me one dark, lonesome night. I began down at her finger, now her arm is out of sight. Well, I gotta tell you about Miss Penroy. She had an hemorrhoid. I used suction, but alas, something went wrong. It was too strong. Now her brains are in her ruin. Well, the fact is, my malpractice got expensive, so I had to switch. But I'm grooving, 'cause I'm removing
Frankie, you have heard about singing boxers and singing policemen and singing dentists, but I want you to meet a great, great eye surgeon who was the only singing eye doctor, and more than anything in the world, Dr. Kelman, Charles Kelman, who, by the way, packs Carnegie Hall, and...
I don't have to meet him, Joe.
You know him?
I know.
He wanted to be on TV with Frankie Avalon.
He's a very talented man.
Frankie and I knew each other years ago.
Right.
Back in 1960, Chancellor Records had 3 recording artists, Frankie Avalon, Fabian, and a kid who never quite made it in music, Kerry Adams. I was Kerry Adams. I went into medical research and went into practice. Frankie went into stardom.
Well, this man is really a genius, you know. What he developed.
He really developed something for cataracts?
Sure, I think that's sensational.
I don't know how ethical or how professional it is to talk about his patients, but Jan Pierce spoke about you on this program. Did you operate on Jan Pierce?
Yes, I did.
Could have been a reciprocal deal, Frankie. He could have given the surgery of Jan Pierce, and Jan Pierce could have given him singing lessons. Maybe.
Well, he didn't give me lessons, but he did sing at the concert I gave at Carnegie Hall, which was the last time I was on your show, Joe, to kind of talk about that concert. And I don't know whether it was being on this show or what, but we packed Carnegie Hall. Jan Pierce did part of the show, and Lionel Hampton did part of the show. But I did the first act myself, and I have to tell you, it was a ball.
What do you want to say,
It was my
Frankie?
first experience, really, in front of a big
Isn't that
group
fantastic,
singing.
though? There's a man who's developed, researched the cataracts and become very successful, and yet his love, there's a deep down inside, he loves singing and loves music. That's great. I just told him, I said, it's better than horses.
Achievements in the field of eye surgery, the treatment of cataracts, are now used at every hospital in the world. But behind that somber medical facade, there lurks a man who likes to have fun in front of audiences. Tell what you do.
Well, one of the things I love to do, of course, is to restore vision to people, and that's basically what I do.
But have you noticed that they're not making the 100-watt light bulbs as bright as they used to?
Only for certain people.
Yeah. I've noticed that the lights aren't as bright as they used to be.
Right. But the other thing I like to do, getting back to me, the other thing I like to do is I think everybody's life should have a purpose. And my purpose is obviously what I said, but I think one of the tricks is to try to combine whatever talents you have in that direction.
At 49 years of age, Charles Kelman is one of the country's leading eye surgeons, and as you can see, he does very well. He has a beautiful home in Long Island, commutes in his own helicopter between his home, his New York office, his country club, and Linda E. Hall Hospital, where he performs over a dozen intricate eye operations every week, operations which he pioneered. Dr. Kelman's success all started when his father said to him as a young boy, "Son, do whatever you want in life after you complete medical school."
My dad drove a butcher wagon when he was a kid to help support the family. And my dad always wanted to be a doctor, but didn't have the money. And it was in the last year of high school that my dad developed cancer. I did college in 2 years instead of 4 and got a degree because I knew his time was limited. Unfortunately, he died about 6 months before I graduated.
But Charles went on to fulfill his father's dream by specializing in ophthalmology.
Mr. Walter, Dr. Kelman's ready to see you now.
Oh, thank you very much. Dr. Kelman realized his father's dream, but as an ophthalmologist, he then went after what was the impossible dream of every eye surgeon.
I had an impossible dream that I was trying to do, to dissolve a cataract through a little hole. This has been every eye surgeon's dream. And I began to think that there must be a better way to take out a cataract other than cutting the eye in half. I worked on this operation 8 days a week, 26 hours a day. I had no time for anything.
Just over 5 years after beginning research in his laboratory on this dream, the answer came to him while he was sitting in his dentist's office having his teeth cleaned with a sonic needle.
I found that I could dissolve a cataract with an ultrasonic needle.
Initially, the AMA rejected Dr. Kelman's revolutionary technique, but the public applauded it because it reduced recovery time from weeks to hours.
I found out and I went to him. That's the time life returned.
The results are beautiful.
This is an operation that is here to stay.
Considering I'm legally blind myself, you know, he's taking care of my eyes.
After seeing what the public saw, the AMA finally gave their seal of approval to Dr. Kelman's operation. Now, every week, he teaches this technique to 18 surgeons from around the world. After fulfilling his dream of perfecting cataract surgery and achieving the success his father had wished for, how did Dr. Kelman feel?
Suddenly, the challenge that I had felt all of these years was missing. And I remember going to, I think it was Caesar's Palace.
He recalled his father's advice about doing what he wanted in life after completing medical school. And now that he's out of medical school, he's doing it.
Do I have any patients in the room? Just wave your canes.
Today, Charles Kelman is not only known as Dr. Kelman, but as Chuck the Knife. Just as he set himself a goal to perfect his operation, he set himself a goal to perfect his act.
I told my office administrator, book Carnegie Hall a year from now.
Dr. Kelman found an agent and asked him, how do you get to Carnegie Hall? And the agent said, practice. So aside from practicing medicine, Dr. Kelman began practicing entertaining. And in his office, next to his medical books, are his joke books. There's even a little monkey, should he ever want rim shots.
These guys have come to spend
He videotapes his performances so he can evaluate and improve his act, and he is improving.
New York is a safe place today if you happen to be a bullet.
John, ask me, what's the most important thing about comedy?
Okay. Doctor...
Timing.
Did you release tension in medical school or as a youngster by telling jokes?
No, I was always a fairly serious person in medical school. My outlet was music.
She said, as long as I'm here, let me ask you some advice. She said, I have a terrible problem holding in my water. What do you advise? And I said, I advise you get off my carpet.
In the beginning, his family and his patients were his best audience.
My kids loved it. My wife was always a very, very excellent critic. And to get a compliment from her was, you know, a great feat.
I did a show for a convention of midgets. And when I was done, I got a standing ovation, but I didn't know it.
And I did not accomplish that feat that evening.
You still married?
No, but it had nothing to do with that performance.
After a year of working and reworking his act in club dates all the way from the Catskills to medical colleges, Dr. Kelman finally performed at Carnegie Hall. We have no record of that performance, but people who saw it will never forget it.
I never saw anything like it in my life.
With a little more swing, he'd be perfect.
He's written his own material, and it's just a lot of fun.
His performance is just super.
I think he's a phenomenal pilot.
He really is a great man.
Take my doctor, please.
I want to live, not merely survive. And I won't give up this dream of life that keeps me alive. That faraway prize, a world of success. It's waiting for me if I heed the call.
As a surgeon and as an entertainer, Charles Kelman, who went on to do The Tonight Show, now has two more dreams in his life. One is
to find a way to prevent what we call macular degeneration or hardening of the arteries.
the other is
I would like to open one of the acts in Las Vegas.
to go to an operating room live to see two fascinating surgical procedures now available to patients who've undergone cataract surgery. Dr. Charles Kelman, one of the world's leading ophthalmologists, will be performing the surgery, and Dr. Frank Field is with him now in the operating room. Frank?
Jane, cataract surgery is probably the most common operation in the world today, and they say that if everyone grows old enough, they're likely to go through this kind of surgery. Let me explain what it is first. This is a model of the eyeball. Let me show it to you. And if we take that eyeball apart, you see inside the eye is a lens. That lens is removed because it becomes opaque. Or the power, you either use a contact lens or you use eyeglasses. In this case, the power is to be restored by a secondary implant. And there are lots of ways of getting the lens out, but now there are new ways of putting it back in again. Dr. Charles Kelman has been operating for the past few minutes, and Dr. Kelman, do you have a moment to talk to us and explain what you're doing?
Sure, Frank. I've taken this patient and I've made a small incision in his eye here. You can see that. What I'm holding here is this intraocular implant, which when put inside the patient's eye will replace his own lens, his own focusing power.
In other words, like the camera, you're going to be replacing the lens in the camera, and without this, the patient would not see.
That's correct. He would see, but it would be very, very blurred. So the only difference is that here the lens goes inside the eye, whereas the camera, the lens is outside.
Now, this patient might see with contact lenses or eyeglasses, but you're choosing to implant a lens, and he is in his 80s at this point. He's wide awake. He feels nothing.
That's correct. He's had a small injection. I'm just slipping that implant right in under his cornea, checking the position. It's now perfectly centered.
This has been quick and painless. And what we have now, if we'll swing our camera over in this direction, I have a little model, and I'd like to show the audience exactly what we can do. This patient that we have in this room will undergo a different kind of procedure. While Dr. Kelman is finishing in the other room, he's coming in here. This is a laser beam which will be directed into the patient's eye, and its aim is to open up the membrane behind. Come on in, Charlie. You can sneak through, a little tight. But the laser beam will zap into the eye, and we will see small holes open inside. And the patient is wide awake, and can you proceed on this, Dr. Kelman?
Sure. Julian, just put your chin right in here for me.
Now, the patient doesn't feel anything. Now, what you'll do is burn little holes inside that little mantle that's in there.
Yes, what you can see on the picture is the outline of the implant that this patient had previously and a white membrane behind it. And this little red dot that you may be able to see is going to poke little holes in that capsule.
All right, can you demonstrate a couple of those little?
I'm just going to raise your chin a little bit, Julian.
Now, this is a case where the lens has been removed and we're going directly into the eye. We'll open up a tiny window inside the membrane. Normally, this would have required surgery, would it not?
That's correct. Here in a couple of seconds with this laser, which was developed in Paris by Dr. Danielle Aron-Rosa.
All right. Now, you're opening the membrane, and you will continue for the next minute or two. And while we do this, let's go back to Jane in the studio.
Thank you, Frank. That was truly fascinating. Just imagine, Dr. Kelman's done 2 operations and you're not even dressed yet. We'll be back in a moment. First, this is Today on NBC.
18-month-old Juliana Polana was born with cataracts, a film over the lens of both her eyes, complicated by an extremely rare condition known as microphthalmia, in which her eyes are half the normal size. Italian doctors said they could do nothing to correct the child's blindness, but the Nassau Sons of Italy organization brought Juliana to this country, and doctors donated their services for an unusual operation to give her at least partial sight. Dr. Charles Kelman, who developed the special surgery and operated on Juliana's right eye today, said he'd never seen an eye so small. Working with specially modified instruments in the tiny eye, he first dilated the pupil, then made a very small incision in one side of the cornea. Through this incision, he inserted a tube which forces a fluid solution into the eye. Then, on the other side of the cornea, another tiny incision is made. Here, a suction tube is inserted, and the suction tube fragments and then sucks out the cataract. Each incision is closed with a self-absorbing stitch. At the end of the 25-minute operation, Dr. Kelman examined the child's retina and said he was very encouraged. Today's operation went even better than he'd expected. And the doctor says he also expects to see Juliana's face light up tomorrow when she sees her parents and the world around her for the first time. And then Dr. Kelman gave the child's parents the good news. Can you ask them just exactly how they feel right now hearing this news?
In questo momento come vi sentite?
Beh, neppure noi lo sappiamo come ci sentiamo. Troppo felici per dirlo.
Siete eccitati?
Felici, felici.
Happy.
Very happy.
Juliana's other eye will be operated on next week, and then she'll be fitted with contact lenses. Her doctor says in about 10 days she should be able to return to her home in Italy. In Freeport, Long Island, Christy Whitker, Independent Network News.
Here we are at the gateway to New York, the Statue of Liberty, and in the background, downtown Manhattan, the World Trade Center, and Midtown Manhattan, with right in the center of all of that, the Empire State Building.
These vagabond shoes are longing to stray right through the very heart of it, New York, New York.
So here we are live on the 21st floor of that same Empire State Building. Good morning, bonsoir, Paris. Thank you all for participating in this very exciting event. I understand that there were 1,600 registrants for this, and there will probably be a lot more coming in today. This is being seen in 27 cities, from Paris all across the United States, Canada, over to the West Coast. And again, I welcome you. You might ask, what is the purpose for doing this satellite telecast? When I was a resident at Wills Eye Hospital, we had an annual meeting. And I think the best part of the meeting was the one day where the surgeons at the hospital upstairs did their surgery, and the 600 participants downstairs watched on a 12-foot screen. This was about 15 or 20 years ago, or maybe even a little more. I don't really remember or care to. But the thing is that what people brought away from that meeting was, of course, the surgical techniques they saw, but they would reminisce and say, remember when old so-and-so lost vitreous or had a hemorrhage or whatever the problem was. They would remember it, and they learned from those events which happened live in the operating room, events that you just don't see on the surgical tapes and films that are presented at meetings. And so I feel that this is the direction that we should take in ophthalmology, and we now have the technology to do it with the satellite and with live surgery with these excellent television cameras that we have on the microscope. This is the way I think people can learn the most, because in surgery, as you know, the unpredictable is what usually happens. And just like in a bullfight, it's that element of unpredictability which makes it interesting. And perhaps the biggest thrill of all is when the bullfighter goes down for a moment. And of course, everybody wants to see how he's going to get back up. So that is the reason for doing live surgery on this program. I will hope to do an intracap extraction later on this morning, maybe on the 4th case.
We'll have Manhattan, the Bronx, and Staten Island, too.
Well, here we are in the Big Apple, the Statue of Liberty at night, shot from a helicopter. Truly one of the great things to see in New York. And New York's most famous cruise ship, the Staten Island Ferry. There in the background, downtown Manhattan, with the Twin Towers of the World Trade Center.
And tell me what street compares with Mott Street in July.
And a little further uptown,
Push carts
little building I helped make famous, the Empire State Building. Well, here we are on the 21st floor of the Empire State Building. Okay, well, this is really exciting to do live surgery like this, knowing that I have a lot of friends watching, and I think it's really the way to teach surgery. To that regard, we are having a very interesting meeting right before the implant meeting. This meeting will be a David J. Kelman Research Foundation meeting at Lake Tahoe, where you will have the opportunity of seeing 24 surgeons operating certified live surgery. There will be 3 screens, 3 giant screens, and in the audience you will have headphones, and you can tune the sound into the surgeon that's losing the most vitreous and pick your picture to listen to.
The David J. Kelman Foundation recently sponsored the second Surgicus meeting in New York City. 24 expert surgeons each had 4 surgical cases videotaped in their own operating rooms. The tapes then were sealed to be shown unedited at Surgicus. Ophthalmologists attending the meeting could then listen to the audio portion of any of the 3 videos displayed simultaneously and ask questions of the surgeon.
God put it in the bag. Anytime you take a lens out of the bag, you take a lens out that didn't come out of the bag, you can put it wherever you want. God says to put it in the bag.
Dr. Charles Kelman explained that viewing unedited surgery gives a more realistic picture of ophthalmic surgery.
And everybody at this meeting is walking around saying, you know, I'm a lot better than I thought I was. And that's really the whole purpose of it, because it wasn't fair what people were thinking about their own surgery.
On the side right here.
Now we just enlarge that a little bit to have room to put the implant in.
Dr. Charles Kelman is a man of many talents. He's an accomplished jazz musician and composer, a helicopter pilot.
What's your handicap?
My handicap where, on the golf course or in surgery?
And he's an internationally recognized eye surgeon who developed a widely used technique for cataract removal. But what makes Dr. Kelman most intriguing is that he's always wanted to be an entertainer.
Well now, my business is eye business. I turn on the lights.
So Charlie Kelman put together an act, and one day he hopes to open in Atlantic City.
You know, no matter what I do, I can't get away from medicine. I was downstairs having a bite to eat, and I was just trying to be friendly, and I saw the waitress scratching herself. And I was trying to be friendly. I said, Miss, do you have hemorrhoids? She said, buddy, just what's on the menu.
When I was 16 years old, my father caught me sneaking out of the house at 2 o'clock in the morning to run away to play with Louis Prima's band. And he took my saxophone away from me and said, look, he said, it's your life. You can do whatever you want. You can be a singer, you can be a composer, you can be a songwriter, you can play with bands. You do whatever you want. It's your life. But first, you'll be a doctor.
A doctor of ophthalmology is what Charlie Kelman became. In the early 60s, he developed phacoemulsification, a procedure by which eye cataracts are removed ultrasonically using a needle vibrating at 40,000 cycles per second. Today, the technique he pioneered accounts for 20% of all cataract surgery and is used worldwide by 1,400 ophthalmologists.
Well, when I studied cataract surgery, patients stayed in the hospital 10 days and then went home and recuperated for a month at home. Now, this patient that I operated on, these patients, they'll be out in the streets this afternoon. They'll be back to work, so it saves an awful lot of time.
Jazz musician Lionel Hampton knew Charlie way back when.
He was a great saxophone player, you know, and he was studying to be a doctor. He played a couple of games with me, you know. That's how good he was, you know.
Later, when Lionel developed cataracts, it was Dr. Kelman he turned to for the operation.
Well, lo and behold, that night I went and played a gig, and there was Charlie playing beside me, playing the saxophone. He had operated on me at 12 o'clock that day.
You fly helicopters. Out of necessity, because in New York, if you want to be in two places at the same time, that's the only way to do it. It's an incredible time saver. It really gives me the chance to lead two lives.
Charlie commutes from his offices in Manhattan to Lydia Hall Hospital in Freeport, Long Island, to check up on patients he operated on the day before and polish up his bedside manner.
Hello, everybody. Sorry to keep you waiting. What's a young guy like you doing with a cataract? Just lucky, I guess,
Just
huh?
lucky, yeah.
Yeah, that's perfect. That's great. Couldn't be better. You can probably see with those glasses already, can't you?
Yes.
Yes? Okay.
Dr. Charles Kelman has certainly found success in medicine. What Charlie Kelman does for his nightclub act is mix medicine with music in hopes of finding another kind of success, keeping the audiences in their seats. In this instance, the audience is other ophthalmologists and some former patients gathered at the Summit Hotel in New York.
And our special consent form, which you doctors may want to copy down, the AMA has now accepted it as a standard in the industry. Our consent form reads, "Don't blame me if after this you don't see. It must be a sport. Don't take me to court. Just don't blame me."
And believe it or not, the good doctors already played Carnegie Hall. It was all part of a charity benefit to raise medical funds.
I was okay. I mean, I was pretty good. I was able to keep the audience in their seats. Of course, I had some pretty good help for the second act. I had Lionel Hampton, I had William B. Williams, I had Jan Pierce, I had Joey Heatherton. So, you know, I kind of rounded out the program a little bit.
Since my racket is eye cataracts, my Cadillac's new.
What drives you? What keeps you going? Why do you need to keep going? Because for me, I think the voyage is much more exciting than the arrival. And getting somewhere, having a challenge, having some goal that you're working for is stimulating.
Charlie Kelman's doing something that most would envy, living out as many lives as possible. If Atlantic City's ready for a little music and medical humor, Charlie Kelman's ready for the challenge.
Have seen the years and the slow parade of fears without crying. Now I want to.
And we're talking with Dr. Charles Kelman this morning. This is a copy of his new book called Cataracts, What You Must Know About Them. Good morning, you're on the morning show.
Yes, good morning. Dr. Kelman, I wanted to ask, is there a surgery in order to correct astigmatism?
Yes, there is a surgery. Astigmatism is when the eye is shaped instead of perfectly round, it's shaped like a spoon. There's a greater curvature on one side than the other. And there is an operation on the cornea that corrects that if you need the correction. Many patients with astigmatism can still wear a contact lens or glasses, but if it's severe, it can be corrected.
Okay, good. Now, besides being one of the foremost cataract surgeons in the country today, he is really quite a character. Flies his helicopter back and forth from Long Island to his practice here in
We're flying together tomorrow, is
well,
that
maybe.
right?
We'll talk about that. We're not sure about that, Charlie. And is also an accomplished jazz musician as well, singer-composer who performed at Carnegie Hall with Lionel Hampton, and we have a piece of that concert in action. Let's take a look at Dr. Kelman in action up on stage. Hey, pretty good. I like that. Very nice. Yeah. Dr. Charles Kelman, saxophone up there in Carnegie Hall, and of course he's represented by by Lee Solomon. If you'd like to book Dr. Kelman.
Weddings, bar mitzvahs.
He's coming with me into the Club Benet, and Lee Solomon is handling that. In fact, he could be Mr. America before this thing is over.
You think I got one question about a song?
Fine.
The song, Why Do You Keep Your Patients Waiting in the Waiting Room? Is that going to be a hit?
Well, with a lot of patience, it'll be a flop.
Thanks,
We may
Dr.
hear it
Kelman,
later.
very, very much. Charlie, good to have you on the show. Right back in a moment.
There's lots of chaff, but there's lots of wheat. Say yes. Well, you could get mugged if you're on the street, but on the other hand, you could be that red-hot lady that you long to greet. Say yes. Yes, I can. Yes, I will. Yes, I'll take a sip. Yes, I'll touch. Yes, of course. Yes, how nice. Yes, I'll fly. And yes, I'll dare. And yes, I'll give. And yes, I'll share. And yes, I am. And yes, I'll be. And yes, I'll go.
The time now, 38 minutes after the hour.
Most of us think of lasers as pie-in-the-sky high-tech mysteries with precious few down-to-earth applications, sometimes, but not always. And this morning, seeing is truly believing. Frank Field joins us now with a demonstration right here in the studio of laser eye surgery.
What you're seeing here is the patient's posterior capsule, which usually is clear right after surgery, but within 6 months to a year clouds up. The red color is the light bouncing back from the back of the eye, the retina, and
We're seeing exactly what you're seeing through the microscope.
And when I hit that button, you can see that hole being made just as I do it.
Take a look around. Tell me what you see. Can you see within and without? You might just find love inside yourself. That's what miracles are all about. Take the falling rain, kiss it with the sun, and a rainbow will come out. Just like anything you touch with love, that's what miracles are all about. And if you believe in miracles, well, that's such a good place to start. And if you can work miracles, then let them come from your heart. Take a look around. Tell me what you see. Take a little time to check it out. But the very fact that there's me here with you, that's what miracles, simple little miracles, that's what miracles are all about. Thank you. German conducting. Aren't they the greatest? Hey, guys. They are terrific, and so are you.
Well, we have a health quiz for you tonight. You might call it your IQ test. That's EYEQ. It's I as in vision. How good is yours is the question. We ask that you get ready to keep score. Dr. Frank Fields with us to tell us how you did on the test. Right, Frank?
Right.
In a moment.
Question number 1. A cataract is a growth in the eye. Is that true or is that false?
Let's say true.
No, false.
As far as I know, it's true.
What do you think? Is a cataract a growth in the eye? The answer...
A lot of people think it's true, but it's actually false. A cataract takes place inside the eye. It's not a film over the eye. It's not a growth in the eye. This is the normal lens of the eye, which sits behind the cornea. When that turns cloudy, it's not a growth. It's a change of color. When it turns cloudy, it's called a cataract. And the only way to fix it is to remove the cataract one way or another.
If you love medicine, you become a doctor. If you love music, you learn the saxophone. If you're a ham, you learn to sing and dance. If you love to fly, you become a pilot. If you're Charles Kelman, you do all of them. And then you write a book about it. And the book is called Through My Eyes. It's, well, the story of your life so far. The book is dedicated, Dr. Kelman, to the underdog. Now, I can't believe you can identify with an underdog because you seem to have the Midas touch.
Well, Jane, I think everybody starts out as an underdog. And certainly I was all through my life. Even when I was a kid growing up, my parents kind of intimated to me that I would never amount to anything. And when I tried to get a recommendation for college from my high school principal, he said, Kelman, I'm going to do you a favor. You're not college material. Go to a trade school. And when I tried to get into a residency at Wills Eye Hospital in Philadelphia, where there were hundreds and hundreds of applicants, they said, look, you don't have a chance.
And now to fast forward, Dr. Charles Kelman is one of the foremost cataract surgeons in the country today. There's even a technique that bears your name. Becoming a golden boy in your profession wasn't enough, though. You had a show business bug. Where'd that come from?
Well, when I was a kid, that's what I wanted to do. I wanted to be an entertainer, and my dad was very understanding. He said, you could be whatever you want, a singer, a saxophone player, whatever, but first you're going to be a doctor. That's because kids listened to their parents in those days. And I did that, and I loved it, and I was very happy I did it. But then kind of, after the challenge was over, after my operation and technique had been accepted, I needed a challenge, and I went back to my original love. And that's where it was really the underdog, because I would go sing for people, and they would walk out.
Walk out? Well, now you're going to open a show in Atlantic City.
Atlantic City at the Atlantis Hotel, right?
This is serious. This is professional.
Well, it is professional.
Describe your act for me.
Well, it's kind of a show business medical act. A lot of the stuff I do is related to patients and doctors and their interrelationship and the funny things that happen in a doctor's office.
What are you wearing?
Well, I come out, you know, in a tuxedo, but then we do a number called Charlie's Place, which supposedly tells you what happens after the visitors leave in a hospital. And the three girls come out. I have a backup, 3 singer-dancers. They come out dressed as nurses with spangles. And I come out in a white doctor's gown, which is totally spangled, almost a la Liberace. And we do a great big band number called Charlie's Place.
You may be internationally famous as Dr. Charles Kelman, but if the marquee says tonight, Charles Kelman, is anybody going to come?
We'll find out.
What if you had to choose? You could either be a world-renowned surgeon, or you could be in show business.
Well, in the book, which is really a book, I think that could help a lot of people get their own lives together because it gives practical advice. But in the book, I described the situation where I had just done Carnegie Hall, and I was really up for anything. And I got a call from an agent to come right down to Florida to replace an act that had closed. And I was ready to go, and I got another call about 20 minutes later from a brain surgeon asking me if he thought my machine could be adapted to take out a tumor of the brain. And I said, yes, it could, and I'll talk to you in 2 weeks because I have to go to Florida to do the show. And he said, I don't have 2 weeks. I don't think this kid can last that long. I said, what kid? And he described this operation where there was a tumor and there was no way to take it out. And I had to decide whether to go to Florida or stay, and I stayed.
Which is why we call you Dr. Charles Kelman, and thank you for being with us. Good luck in Atlantic City.
Thanks, Jane.
Break a leg? Oh, dear. We'll be back in a moment. This is Today on NBC.
My next guest is one of the most well-respected ophthalmologists in the entire world. He is the author of this book, Cataracts, What You Must Know About Them. Please welcome Dr. Charles Kelman.
This man who sits next to me here is a man of very diverse talents. My word, and I mean diverse. He is a pioneer first in the field of ophthalmology. He is one of the world's leading eye surgeons specializing in cataracts, laser beams, all of that heavy, wonderful stuff that's helping all of our lives. But he also is a great jazz saxophonist, having performed at both Carnegie Hall, without his laser beam, but with his saxophone, and of course with the great Lionel Hampton at the President's inaugural ball. This is his own story, and it's called, appropriately enough, Through My Eyes. He is an extraordinary man. Would you welcome Dr. Charles Kelman? Both of those have to be important professions. I don't dare call one a hobby and the other one a profession, because they really...
Thank you.
Right. They must mean separate things to you, too.
Well, one is a balance of the other. I mean, one situation is so heavy and the responsibility is so great when you're operating on someone's eye and restoring their sight. And there are instances where the patient only has one eye. It's a very heavy situation. And the other is just a wonderful situation where you're communicating with an audience and making them comfortable, making them laugh, and making them sing. So one balances the other beautifully, beautifully.
Weren't you, Dr. Kelman, responsible for the operation to remove the cataracts, which can be done now in offices where it used to be a 2-week stay in a hospital?
Right.
You stopped all that with your invention.
Yes, it's an ultrasonic needle that dissolves cataracts. And it can be done through a tiny opening in the eye rather than cutting the eye in half. And so now that's done all over. You don't have to come to me for it. It's done all over the world. So it's an exciting
amazing,
thing.
yeah.
Yeah, it's an exciting thing.
How do you have those big nights? Because I've seen our musicians here after a bad night in a jazz room. You mean your hand doesn't shake the next morning?
You must. They look pretty good now. No, you must separate the two. I'm booked for a week, believe it or not. I'm booked for a week in Atlantic City.
I heard that.
Okay, that week, I'm not doing any surgery.
I hope.
And maybe a few days afterwards.
Yeah.
Just so not that I couldn't do it, because doing surgery after you do it is like tying your shoelaces. It's very simple. But for the patient's peace of mind and comfort, I'm not doing it.
They don't want you coming in with a sax and blowing a tune at them. Was your father or your mother more interested in your medical career or your music career?
Merv, when I was a kid, my dad caught me sneaking out of the house when I was 16 years old to run away from school to play with Louis Prima. And he was a very understanding guy. And he said, Charlie, it's your life. You can do whatever you want. You can be a singer, a saxophone player, a songwriter, whatever you want. But first, you'll be a doctor.
Oh, boy. He wouldn't accept doctor of music, right?
Well, you know, it was the pride of every family on that block to have a kid who was a doctor. And a musician who was a little less prestigious. It was somewhere between a convict and a dentist.
Who told you that?
Well, that was in his eyes. And, you know, in those days, kids listened to their parents. And I listened, and that's when my trouble started with that decision.
Were you a good student in medical school?
I was so good.
Yeah, how good were you?
That when I graduated from high school, my principal refused to give me a recommendation for college. He said, Kelman, you belong in a trade school. And this is really what this book is about, because all through life, people have been telling me, Charlie, you can't do this. You're not good enough. You're not smart enough. You're not good looking enough, although they were wrong there. But that's right. And so...
People try to stop you.
Not me. You, everybody.
Yeah, you can't do that. Yeah.
And this book, this story, just shows, although it's related to medicine, but it's primarily a story of how you should set your goals a little higher than you think you can reach, and then go for them. And don't let anyone stop you.
Yeah.
And I try to show people in this that if I could do it, if a guy who couldn't get a recommendation from his principal could now, you know, I have the biggest cataract practice in New York, and I fly my own helicopter, and, you know, I live in Trump, a lot of exciting things. I live right next to Liberace.
You're kidding.
Trump Tower.
That's
fun.
Yeah, but your styles are different.
Our styles are different.
Yeah. He plays the melody, and you're in there. And you ended up playing with Lionel Hampton at the inaugural ball?
Sure. When I was a kid, Lionel used to book me to do record dates on baritone sax. And then some years later, he came to my office, not knowing it was the same Kelman, for cataract surgery. And he said, hey, you look familiar. I said, yeah, Lionel, I used to play in your band. He said, whoa, wait a minute.
Put that needle down.
And now it's great because I perform with him a lot. And when we're on stage, we have such a good time. I joke about his operation. I say that I did such a great job on Lionel that after his final visit, he walked into the broom closet and said, down, please.
I love that. Well, I'm going to show them the book so they don't miss this unusual but certainly compelling story through my eyes. The story of a surgeon who dared to take on the medical world. And you forgot to add "and won."
That remains for the reader. Some people may think I lost.
No, you won.
Thanks.
And you're going to hear him play the sax.
Dr. Charles Kelman, ophthalmologist, cataract specialist, and a fine saxophonist. Thank you, Doctor. We'll come back after this message.
It is a great honor for me to present this first lecture on innovations in ophthalmology. I am deeply touched by this recognition, which for most innovators is reserved for their funerals. My presentation, Creativity in Ophthalmology, directs itself to delineating several forms of creative thinking as they relate to some of the advances made since man began to wonder why we see, why we cease to see, and how we can prevent and cure the cessation of sight. I live life, and I try to do as much and as many things as I can that are fun to do and are good for other people.
World-famous eye surgeon, up-and-coming nightclub entertainer, author, helicopter pilot. He is living life to the hilt in the elegant heights of the Trump Tower of New York City, saving eyesight in his office suite in the Empire State Building, or knocking them dead in this Atlantic City casino. At age 55, Charles Kelman is doing it his way. But he staked his claim to center stage only after years of struggle and some bitter defeats.
The only thing wrong with doing a show is that it has to end.
His odyssey began here in Philadelphia. It was 1959, and by day, Charles Kelman was a resident doctor at Wills Eye Hospital. However, by night, he was an up-and-coming musician.
There was a great record company in Philadelphia, Chancellor Records, and they had two stars, Frankie Avalon and Fabian. And they had one other who was not yet a star, Kerry Adams. That was me. I was singing under a pseudonym because in those days, the medical profession would not have accepted this duality. So I made a recording called Telephone Numbers. They recorded it, and it was pick of the week in 52 cities.
Oh, I got so many numbers.
4 stars in Cashbox and Billboard. They were fitting me with tuxedos and glitter and glamour, and I said, God, it was so easy. One record and I'm a star. And then a week later, something happened which totally changed the history of music. Chubby Checker came out with a twist, and it killed everything that was on the airwaves, including poor old Kerry Adams.
And to the poor old Kerry Adams was buried by the twist. And now, poor, unknown Dr. Kelman had to decide what to do with the rest of his life. He craved a standing ovation. If not in music, then it would have to be in medicine. He was looking for a breakthrough. In 1962, he found it. A freezing technique that worked better than forceps in cataract surgery. But the medical establishment first ignored his findings, and then, on top of that, gave the funds and the glory of publishing the first results to the very doctor who had originally dismissed Kelman's theories. But Dr. Kelman counterpunched with an even better idea that landed him the largest research grant in the history of ophthalmology.
And that, after a few years of misery and skepticism, became the standard way.
The standard way, with Dr. Kelman getting the credit. Not only for the freezing techniques, but also for the revolutionary methods of cataract removal using ultrasound. In addition, he has pioneered improved methods of lens implantation and is the inventor of the high-tech surgical instruments that are now being used around the world. Each advance was resisted by the medical establishment to the point where Dr. Kelman was shut out of certain hospitals. It was a bitter struggle, but it ended in personal and professional triumph.
And now this challenge that I had been living with for 9 or 10 years was suddenly gone. missed it. I missed having a cause, having something tough to do.
With no mountains left to climb in medicine, he decided to return to the scene of his first defeat. At age 45, he put his hard-won professional dignity on the line. The doctor decided to take another shot at show business. Only this time, not as Cary Adams, but as the singing, sax-playing, stand-up comedian, Charlie Kelman. He made the decision just like that, then put himself in a position where he couldn't back out.
I'm in a taxi cab, going back to my office the next day, and I see Carnegie Hall. I said, that's what I'll do. I'll give a concert in Carnegie Hall. So I go to my office manager, and I say, Joe, book Carnegie Hall on a Friday night a year from now. And I worked really hard at it, and when I finally did Carnegie Hall, it was great.
10 years later, he still ranks as one of the world's leading and busiest ophthalmologists. But he's also a veteran nightclub performer who's at home here in Atlantic City's Atlantis Casino Hotel.
Hi, everybody. Welcome to the Atlantis. You folks here for a good time tonight?
You could say Charlie Kelman's up to his old tricks, driving the medical establishment once more up the wall. Only this time, he's doing it with song and satire. Is this any way for a world-famous surgeon to act? Yes, it is, in Charlie's place.
And now I'm going to give you a sneak look into what goes on inside a hospital. Let's call that hospital Charlie's place. After the visitors leave.
He's back to his old Philadelphia lifestyle. Music by night, medicine by day. But the nightclub's a long way from the operating room. And one day, the distance just got to be too much. He attacked the problem in the typical head-on Kelman style. We'll discover his radical approach to this crisis next on Primetime.
As we go.
Well, one day I was on my way into the city, late for the office as usual, and I was in a traffic jam. I was in a convertible, and I was sweating and just cursing my face for having to sit there and wait. And suddenly, over my head, pop, 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 I see this bird flying over. I said, that's where I should be, not down here. I got to the office, I called the heliport. I said, how much time will it take for me to learn to fly? How much does it cost? 1 month later, it was me, into the city.
Naturally, once he began saving all that time by flying between his medicine and his music, his schedule opened up enough for him to write a book, Through My Eyes, the story of a surgeon who dared to take on the medical world. It is also the story of a man who wants to live every day to the utmost. What's that mean? To answer that, Primetime attempted to follow him from dawn to dusk, one beautiful and hectic day in New York City. It is a portrait of life at the top, racing the clock. 6:30 a.m., start with a jog in the park with a member of the chorus line from the show.
One of the nicest things about New York is early in the morning when no one's around and you can be jogging and nobody bothers you.
Next, it's out of the park and into the limo for a ride to his office in the Empire State Building. He has got a busy schedule ahead of him with 6 cataract operations scheduled for this afternoon.
When I started, they did about 200,000 operations a year. They're up to 1 million now in this country. Yeah. And if you live long enough, you're going to get a cataract. Mm-hmm. It's nature's way of saying, hey, I've seen enough.
The Empire State Building.
There you go.
A fresh flower in the lapel that no doubt will be wilted by the time that this day is done. Checking on the chopper flight.
call Doug Stein and tell him that we will be landing there at around, we'll be done here by 9:20, 9:30, around 10 o'clock.
A touch of a button and a laser beam clears up this patient's vision.
This is the little scar we're going to remove with this laser. That scar is just getting in the way of her vision, and she'll see a lot clearer once we open up that little white spot.
Next, it's a quick consultation with his music arranger about an upcoming nightclub appearance.
And then I do this whole thing, usually to spectacular applause.
You hope you play it right.
Then it's out of the office, 9:20, 2 minutes ahead of schedule, heading downtown to where the helicopter is parked. Today, he's on his way to Brunswick Hospital in Long Island, where they're opening up a cataract clinic and where they want Dr. Kelman to do consulting as well as some surgery.
It's a huge hospital and apparently one of the most efficient hospitals in the country also, so it'll be an interesting experience to see some of his most modern equipment that he's got out there.
What do you say, Dr. Stein?
In Long Island, he is greeted like visiting royalty and taken on a whirlwind tour of the facility. He's come a long way from the days when he had to beg for some lab space in which to do his research. Back in the air, where the doctor finds time to relax.
The flight out is about 15 minutes and back, so you're just saving time all over the place and able to do so much more at a more relaxed pace. I am more relaxed flying this thing than I would be if I were sitting in a car, especially late as usual and sitting in some traffic jams.
He lands this thing on the pad. It's 11:30, and he's heading uptown for a quick talk with his show business agent.
Get me a job, I need the work.
How are you, Doctor? How you doing?
How you doing, baby?
Very good.
You've been keeping me awake for 2 nights now.
Yeah,
with that little bomb you dropped on me.
Yeah.
Any chance?
I spoke down on King. He wants to see the tape.
After the meeting, it is back in the limo and uptown for a luncheon meeting.
Nice to see you.
1 p.m. The limo is rolling, and a half dozen patients are waiting for this man to remove their cataracts and implant lenses to give them back their sight. He works in one operating room as another is being prepared. In less than 2 hours, he has finished his surgery and is heading back uptown for a voice lesson. Up and down the scale. And finally, at 5 o'clock, it is time to head home to the golden fortress of the Trump Towers. Like so many who live in this monument to success, it's been a long, hard drive to the top. But it's had some very special memories.
A young Marine was being honored at the White House. He had lost one eye and could only see light from the other eye. And the president was saying to him, "Wayne Hanby, you've given so much for your country. Is there anything I can do for you?" And he said, "Mr. President, I only have one eye, and it's such a risky operation that no one wants to undertake it because they can't promise anything, and they don't want to lose the sight I have. Can you recommend someone for me to go to?" And Wayne Hanby showed up in my office with a letter from the president. When I examined his eye, I was certain that nothing could be done. But at the president's insistence, I operated. And due to some power far greater than my own, Wayne Hanby today sees 2020.
This kind of reward is a result of Charles Kelman's drive to succeed. It is a drive that still nags him at the end of the day with the burning question, what is next? With the evening just beginning and Central Park spread out beneath him and dinner guests due at any minute, Charles Kelman plays a song alone before getting to work on tomorrow.